I know it sounds like I'm talking about this each and every week, and that's because I am. I really am. Our mental health is so important. And I want to make sure that I continue the legacy of the late, great Jason Clopton, the teen whisperer, and do what I can, do my part to destigmatize mental health, especially for our children. I remember the day that Jason Clopton came to our home in Cottage Grove. He was Andrew's new therapist. And he didn't do things the traditional way, right? He brought a basketball, and he had the Jordans, and he had the muscle car. And he pulled up, and he immediately had Andrew's attention and trust. And he helped my son work through the difficulty of being the older brother of 3 special needs children. And as soon as I started my podcast network, he was the host of the Teen Whisperer podcast, award-winning teen mental health podcast. And Jason passed away much too soon, left behind a wife and 2 daughters, one of them 5 years old. And so just as a promise that I made to myself is that I would continue to help continue the conversation about mental health, especially for our children, our teenagers. That was his passion. And we know how difficult it was mentally for us for COVID. And we were able to express ourselves. Our teens and our kids, they got it bad. And so I'm always looking for programs and services and opportunities for parents to engage their children. If you need a place, if you need a therapist, if you need services, if you need resources around mental health, I want to make sure that I'm a resource and I provide that to you. And so I had no idea, and this is just me not asking the right questions, that my friends at Accra had some resources and available that are available for teens and kids who, have mental health issues and need services and resources and programming. So I'm so glad that Sarah Boyd is here from Accra. She is joining us courtesy of the John Schuster Caldwell Banker Hotline. It is Minority Mental Health Awareness Month, the last Saturday in this month. Sarah, every single week I have been talking to someone about mental health and teen mental health and adults and women and Black women. But, it's Minority Mental Health Awareness Month. Talk to me about programming that Accra has that is available. I use Accra in a whole nother way. So I'm always talking to parents about fiscal responsibility and making sure if their kids have autism that they, have somebody who can help them understand, how to navigate the financial aspects of that. But there's a whole nother component and services that you're providing for mental health.
Yeah, I know. I just have to say thank you so much for having me on. It really feels like an honor to be here. So thank you. And anytime I get a chance to talk about mental health, it's a passion area of mine. It's probably why I'm in the field, but I just get so excited to talk about it. Accra, as you know, because you've talked about it so much and you've had your own experiences, historically we've been known for some of those, home and community-based home care services for people with disabilities and older adults. And we've been fortunate enough in the last couple of years to add mental health services to our menu of options. And for me personally, what I think has been really cool about that is Accra. I love Accra. It's a wonderful organization. And one of the things, though, that our system, I think, historically hasn't done great, it's not by fault of anybody, but just that we've kind of lost sight of, is that a lot of people with mental health fall through those cracks. There's a lot of services and supports in other areas of our systems, but people with mental health diagnoses often fall through the cracks. And adding that to our menu of options has really uniquely positioned us, I think, to fill that gap and to also help families, because a lot of people with neurodevelopmental disorders or developmental disorders, they also have co-occurring anxiety or depression. It's super common. And so we sort of have been uniquely positioned, sort of serendipitously, to help provide services to those individuals, of course, also to a whole host of other types of clients with other types of disorders as well. So I feel so fortunate that I get to be part of that, because I don't know that there's other organizations out there that really have been able to marry those two worlds the way that we've been able to so far, which is pretty cool.
And this is the thing that I love is right now,
yeah.
folks can get in because you provide in-person counseling in Minneapolis, Duluth, Hibbing. You have Virginia clinics, and also virtual therapy via telehealth to clients throughout Minnesota. And this counseling is available to adults, adolescent, kids. And wait a minute, this is the part that I love because, the one thing that I'm hearing from parents is there's a wait list. My child has an emergency right now, but you want me to go over here? There's a wait list. You have no wait list for telehealth appointments with Accra, girl. Come on, give me the scoop on that.
I know, right? So, So we have in-person, like you said, in-person therapy in Minneapolis, Duluth, Hibbing, and Virginia, because we're all over the state. And then we have the virtual therapy. But actually, depending upon which clinician you get lined up with, so the virtual, there's for sure no wait list. In person, a lot of us don't have wait lists either. So it just kind of depends. But it's really, really nice because that we have been fortunate enough to be able to sort of meet the needs of the community in that way without having to, kind of push people off for a little bit. And, no disrespect or anything, of course, because that is, sort of the nature of resources right now. But we are not in that position right now. Right now, we're in a position where we can take clients on pretty quickly, which is awesome.
That is so good because, again, as a parent, when I talk to people and they're having a crisis and they say, well, where can we go? And, and people say, oh, well, there's a wait list here and this one is these many months. And they're like, well, what am I supposed to do in the meantime? I have a crisis right now and I want to start getting some help for my child right now. So it was so good and reassuring to me to know that right now today, if your child is in crisis or you are in crisis and you need a telehealth visit with a professional, one is available for you.
Yep. Yeah, it is. And, you hit kind of on an interesting point that especially with those crisis settings and stuff, if they, end up in crisis in any kind of, heaven forbid, any kind of facility or anything like that, one of the things I think that we're seeing in our system is it's hard to connect them then after the crisis to those community-based services because of those wait lists. And that is just simply not the case here. If we get those phone calls, we really do our darndest to get them in right away. And I think it's important, especially when you're coming out of those types of crisis settings.
And another thing that is going on, and we're talking to Sarah Boyd with Accra in honor of Minority Mental Health Awareness Month. Only 39% of Black folks, 25% of Asian folks, 36% of Hispanic and Latino adults with any kind of mental illness were treated. And this is according to the U.S. Department of Health and Human Services just in 2021. So these aren't old statistics. And so that leaves a lot of gap room, Sarah, and it really frightens me that, we are not getting to, people in communities of color are not getting to a therapist when we need to.
Yeah, I agree. And I think it's so important. And when we talk about, mental health awareness, especially in a month like July, when we're really focusing on the minority populations, to get that awareness out there, and I've heard, talk a lot about, I don't even know what questions to ask. That is part of what is so important about having these types of conversations, because then we have individuals who are like, oh, I can just pick up the phone and call. That's all I have to do. And then you've got a provider who knows the right questions to ask you, because sometimes you just don't know what you don't know.
Yeah.
And you need that provider to be able to kind of help facilitate that conversation to help get you in the right direction, hopefully close that gap, between the, the minority populations and the rest of the population.
Yeah, and I want to make sure that folks know how to reach you. If there
Yeah.
is a family who's listening or a person who's listening who, feels like they need to see someone or, just kind of has some reservations about their children and don't really know where to start or listening to our conversation and they're saying, okay, Sheletta speaking my language. I've been, turning a blind eye. I need to just get my child the help that they need so that they can get better mentally. We take our kids to the doctor if they break a leg, but when they break a heart, we want to tell them to toughen up.
Right.
If their mental stability is broken, we want to tell them you'll be fine. Just toughen up. Stop all that crying.
Mm-hmm.
But if they break an elbow or ankle, we'd be the first ones to the doctor, getting the cast, following the instructions, picking up the prescriptions, but not the mental health. I don't know when are we gonna get there, Sarah, where it's just as common.
I don't know. It's so funny you say that because I was just having that conversation with somebody the other day about how, we've come so far in destigmatizing and getting the word out about it. And also we have so far to go. And that example that you just used, I use a very similar example when I talk about it. Hey, we're super willing, to take an hour off of work at the end of the day to go to our, routine physicals or whatever, because that's kind of acceptable. But we still struggle, even though we're more aware of it. We still struggle to take that extra hour out of our day if we need to address our mental health. So I think we have I think we have a little ways to go. I think we're going in the right direction, which is positive. But yeah, I hear you, that I don't know when that's going to come. I'm hoping soon because we need it. We need to have that awareness out there and we need people to feel comfortable accessing the services when they need them.
Yeah, and I want to make sure folks know how to get to Accra. Before you go, I want to make sure we give them the website so that they can get there, they can go there, they can look, they can share this with, some folks may be listening and their grandchild. They need to get this information to their daughter who's not listening. So whether you need it or you need to pass it along to somebody else who is not listening to this show, it is our obligation to make sure that the people around us have the resources and tools that they need to succeed. And this is just one of those. So how do we get in touch with Accra?
Yes, I would love to share that. So we, as you said before, we can do individual therapy or telehealth or in person. We also have ARM services, which is a skills-based service for adults. All of that information is on our website, so accracare.org. If somebody wants to make a referral, we have a couple ways they can do that. They can call our number at 952-935-3515 and ask for our mental health department. They can go to our website that I just gave out, and they can click services, and then on the drop-down menu, mental health services, and if they scroll down, there's a way to make a referral right on our website. Or they can email us at ARMS, ARMHS, at accracare.org. So lots of options for people.
Yeah, and whether you have an internet or not, you got a phone number, you got a website, you got an email. Use one of those three to get the information, resources, and help that you or your loved one needs. Sarah Boyd with Accra, thank you so much for joining us on the John Schuster Caldwell Banker Hotline.
Yes, thank you so much for having me. I sure appreciate it. It was great.
You're welcome. And y'all stick around. We've got more to come.